PAE BPH, how it shrinks the prostate with tiny beads. Imagine a tiny bead that can help shrink an enlarged prostate without surgery. That's what prostatic artery embolization does by using small particles called beads or microspheres. These beads are injected into the arteries that supply blood to the prostate. Once inside, they block the blood flow, causing the prostate tissue to become starved of oxygen and nutrients. This process is called ischemia, which leads to tissue death or infarction in the targeted areas. The procedure is done by an interventional radiologist who inserts a small catheter into an artery, usually in the wrist or groin. Using live imaging, the doctor guides the catheter directly to the arteries feeding the prostate. When in position, the tiny beads are released through the catheter, blocking the blood vessels. This targeted approach reduces blood flow specifically to the prostate, causing the gland to shrink gradually over several weeks. The shrinking happens because the lack of blood causes the prostate cells to undergo programmed cell death, known as apoptosis. As the tissue dies and softens, the overall size of the prostate decreases. This reduction relieves pressure on the urethra, which is the tube that carries urine out of the bladder. When the prostate shrinks, urinary symptoms like difficulty starting urination, weak stream, and frequent trips to the bathroom often improve. This minimally invasive technique offers a good alternative to traditional surgery like transurethral resection of the prostate. It tends to have fewer complications, less bleeding, and a quicker recovery time. Many men experience significant symptom relief and improved quality of life after PAE. Because it targets the blood supply, the procedure also preserves surrounding tissues and nerves, reducing the risk of side effects like incontinence or sexual dysfunction. In essence, PAE shrinks the prostate by cutting off its blood supply with tiny beads, leading to controlled tissue death and reduction in size. This process helps relieving urinary obstruction caused by benign prostatic hyperplasia. Always remember, if you are considering this treatment, it's important to discuss it with a healthcare professional who can evaluate your specific condition and guide you through the options. Medical advances like PAE show promising results, but individual responses can vary, so personalized care is key.